Um, by the way, New York State EMTs are now getting trained for CPAP use, and we're actually going to start using it in the pre-hospital environment. Okay? So you guys may not see it on your state exam, but in your next 3 years as an EMT, they're going to be talking about it. Stoma, I'm going to guarantee you that there will be at least one stoma question on the final exam, probably at least one, maybe two on the state exam. The stoma. How to treat people with a stoma. What happens if you have a complete laryngectomy as opposed to a partial tracheotomy? What is the difference? Okay? What happened? You got to close the mouth and the nose, right? You don't have to. But if you have a partial or just a tracheotomy, you have to close the mouth. So you have to know the difference between the two. So if you don't understand the medical terminology, you're not going to get the question correct. And then the FROPVD, the pressure activated ventilation device. Okay. Patient assessment. Patient assessment. Trauma versus medical. Different components. Scene size up. Primary assessment. History taken. Secondary and reassessment. What are the various steps within each one of these steps? How do you do them? How do you do them properly? Okay? MOI versus NOI. Everybody remembers what those terms stand for, right? Yeah. Mechanism of injury versus nature of illness. Chief complaint. AVPU, understanding the person's level of consciousness. How do we check it? When do we check it? And why do we check it? Proper stabilization of the spine. Airway. How do we open it depending on the situation, medical versus trauma? Suctioning, we talked about earlier. And then how do we maintain it? Usually put in an OPA versus an NPA, but you have to know what the indications and contraindications are. Breathing. Is it adequate? If it's not adequate, what are you going to do? How do you give them oxygen? What device are you going to give them? Inspecting, palpating, auscultating, and then properly treating injuries. How do we treat a sucking chest wound, an open chest wound? How do we treat it?
Occlusive dressing.
Occlusive dressing taped on?
3 sides.
3 sides. What if you see an answer and it doesn't have the word occlusive dressing in there?
You're wrong.
What's another terminology for occlusive dressing?
Flat.
Airtight dressing, right? So it may say an airtight dressing as opposed to inclusive dressing. Okay? Circulation. Is the person bleeding? If they are, is it hemorrhagic bleeding? We're going to treat that immediately. If not, we can worry about it later. Pulses, where do you check them? Depending on if the person is alert and conscious versus unresponsive. The skin, what are you checking for? Color, temperature, and condition. How do you treat them for shock? And then capillary refill in pediatrics, which we talked about. All right? And then giving them a priority decision, high versus low. Rapid transport versus non-rapid transport. All right? Understand sample, the proper questions that have to be asked, and understanding what each one of those letters stand for. The same for OPQRSTI. Secondary assessment, what are you looking for? How do you do it? Head to toe assessment. And what are you looking for? DCAP, BTLS. Understand what all of those terms mean. All right? Checking the vital signs. All of the vital signs. Blood pressure, skin temperature, color, and condition, pulse, respirations, and pupils. Okay? Medical. Look at the red arrows. No. Signs and symptoms, assessment, treatment, and the different diagnoses with respiratory, cardiovascular, neurologic, gastrointestinal, urologic, and endocrine. The other ones are important, but they're not as important. All right? Anaphylactic reactions we'll have them when we talk about actual shock or anaphylactic reactions themselves, and then poisoning comes later. We'll talk about gynecological, will be more in the realm of childbirth type of stuff. So I would be familiar with this stuff. Respiratory, cardiovascular, neurologic, gastrointestinal, urologic, and then the endocrine system, especially diabetes patients. And then hit on anaphylactic reactions also, right? Medical, poisoning, different routes of exposure. Remember to call medical control. When you see that question, you should look for the answer that says call medical control. Defibrillation. How do you defibrillate somebody? What are the proper protocols? All right? How do we use that device? Okay? Understand the basic rhythms, and what are the two shockable rhythms?
VFib and
Ventricular
V2.
fibrillation, what's the other one? Ventricular tachycardia with what? No pulse, right? You have to know them. What's this one?
Flatline.
Flatline, what's it also known
Dead,
as?
Murray. Dead.
A systole, okay?
And dead man.
Good. And I talked about anaphylaxis already, right? I would know these meds. Know these meds. These are EMT meds. Nitro, aspirin, epi, albuterol, activated charcoal, glucose, and O2. Know the indications,
Narcan.
contraindications, dosages. Know the 5 rights. What's the 6th right? Write it down, but what's the 6th right is what? Proper documentation, right? Reassessment, and then when to call medical control. Some of these medications we give under protocol of standing order 1 time or 2 times, but then anything we want to do after that, who do we have to call? Medical control, all right? So you want to know that, all right?